If your toddler isn't talking yet and you have been wondering whether something is wrong, this video is going to give you the answer that you need. My name is Eugene from ABA Labs, and today I want to help you understand why some children are late talkers, what signs are worth taking seriously, and most importantly, what should you do next. First, let's define what we mean by speech delay. Speech delay simply means that a child's ability to use spoken language is behind what we expect for their age. Now, this can look very different for every child. Some children understand everything you say, they follow instructions, they respond to your name, but they struggle to get the word out. Others may have difficulty both understanding and using language, and the severity can vary a lot. Some children are what we call late talkers. They catch up on their own with no intervention needed. But others need support, and the challenge for parents is knowing which category their child falls into. That's exactly what I want to help you figure out today. So why might a child not be talking? There are several possible reasons, and it's important not to jump to conclusions. The first possibility is that your child is simply a late talker, and some children develop speech a little later than others, and catch up completely without any need for intervention. This is more common than most parents realize. The second possibility is hearing difficulties. If a child isn't receiving language inputs, if sounds are muffled and unclear, they can't develop speech normally. This is why a hearing test is often one of the first things a doctor will recommend. The third possibility is a developmental delay that is affecting communication skills more broadly. And the fourth, which many parents worry about, is that the speech delay may be connected to autism, particularly when it comes alongside differences in social interactions and behavior. Speech delay alone does not mean autism, but when speech delay occurs together with limited eye contact, reduced social interest, and repetitive behaviors, that pattern is worth investigating further. Let me give you some specific signs to watch for. You should consider seeking support if your child has few or no words by 18 to 24 months. Most children should have at least 10 to 20 words by 18 months and should be starting to combine two words together. Things like more food, more milk, take ball, or daddy go, mommy come. Does not attempt to communicate using gestures like pointing, waving, or reaching out for things. These are early communication tools, and if your child isn't using this, that's worth noting. They does not respond consistently when they call their name also. This is one of the earliest and most consistent early signs of developmental differences. They also have difficulty following simple instructions like come here or give me the ball. They also show limited eye contact or reduced interest in interacting with you or other children. Seeing one of these in isolation may not be significant, but you are seeing several of these together, please don't wait. So as a parent, what should you actually do? Step 1, don't wait and hope it resolves on its own. I've worked with many families who wish they had sought help earlier. The earlier you act, the better the outcome for your child. Step 2, speak to your family doctor, share your observations, be specific. Tell them exactly what you're seeing at home. You can also ask for a referral for a developmental screening or an assessment. You also can consider an assessment from an early intervention provider or a developmental psychologist. This will help identify whether your child has a speech delay or what kind of support would be most helpful. You don't need to have all the answers before you seek help. That's what the assessment is for. So for parents, here's the good news. Early intervention is highly effective for children with speech delays. Through structured targeted therapy, approaches like ABA therapy, speech therapy, children can build functional communication skills. And I want to be clear, this doesn't mean your child will develop speech through words alone. Some children communicate through gestures, picture exchange communication systems, or technology-assisted communication. The goal is to give your child a way to communicate that works for them. The earlier we start, the more we can take advantage of the child's brain during the early years. The window is very, very precious. If your child isn't talking as expected, you're not alone, and you don't have to figure this out all by yourself. At ABA Labs, we offer consultations where we can talk about what you're observing, answer your questions, and give you honest opinions on what you to do next. Thank you for watching this video. See you in the next video. Bye bye.